Welcome back to movementprofessional.com. We're here at Pain Relief and Physical Therapy. Today I want to talk about this ALINE tool, which is a tool to measure lower body alignment. We can also use it to measure someone for medial arch supports if necessary. So it's a nice little tool. We tend to use it here for feedback training to show people, how to get their arch lifted or how to coordinate the foot, knee, and ankle alignment with certain functional movements like squatting and lifting. So basically what it is we got this plate here, alright, that you put your foot in and it measures your alignment using these ankle bars. You put your toe between this clip and it just keeps you in the right position so that your foot's not turned out or turned in. It just gets it in a neutral foot position. And then you also have these little demarcations for sizing when we look at medial arch supports, which I'll show you in a bit. Alright, so then we just put that basically into this board here, which again has just foot demarcations depending on the size of your shoe or how tall you are, and that just again gives you a little bit of a baseline for a neutral foot position. Alright, so we'll put this back in and see if you can get a sense of what we're trying to do here. I'm going to put my right foot in, and this toe clip will go between my first and second toe, and my left foot is going to be on the white foot here, which is for people that are above 5'6". Alright, so you're looking at my ankle bones here, and you want to see that they're pretty balanced between the two ankle stays here. And you can make them adjustable, so this is for a wider foot right now. I'd probably be able to fit with a narrow one, but the idea is that it's just equidistant between here and here and here and here. Alright? So if I stand and relax, a lot of times you'll see, and I have a little bit of it, where my medial ankle bone falls inward towards the inside ankle stay. Alright? So normally we'll have people turn around and use a mirror so they can get a sense of where the ankle bone is in relationship to these stays. Alright, so a key point here is that we've already got people standing with their feet facing forward when they're in this device, which is not typical for most people. Most people stand with their feet out a little bit. However, this is the more neutral position of the ankle and a more balanced position for it, and it gives the medial arch bony stability that isn't there when the feet are turned out. So just by having the foot forward, you may notice that the arch is in a more balanced position, but people throughout the course of their functional life of standing may actually have more of a drop in just because their feet are turned out. So this is a way to actually teach people the benefit of standing in a more neutral position, but also showing them what that means by using a mirror and having them do little exercises where you try to basically just, if you're here, you try to balance the ankle so it's equal between both sides. And then you can make it more dynamic by, one, we put a laser on, which might be a little faint in the video here, but the laser should be right up in the middle of the kneecap here when I'm in a standing position. Now if I go into some type of squatting position, what you want to see is that I keep this ankle position pretty well balanced between the two bars there, and the red line can come a little bit to the inside of the kneecap, and it depends on how deep I want to go. So I have a pretty narrow stance here for a squat, so in order to get deep without my knees shooting forward, I'm really going to have to open the hips wide, so my knees are going to go out compared to that red line, and if anything I should have the outer ankle bone get closer to this outer ankle stay as opposed to having things fall in this way, which would cause this knock knee or valgus position, which you're trying to stay away from. So this is just a good tool to teach people. Again, we can turn around and we have the mirror right here. So bring that a little closer and we'll take a look at the mirror. So I can see now where my ankle position is, and I want to try to maintain as I go into the squat this good position of knees outside of the red line, and then when I come back to standing, the knee is going to go, the red line is going to be right in the middle of my kneecap, and I'm going to have an equal ankle position. That's how we use the tool for feedback training and strength training. And now we can also measure insoles and see the benefit. So let's use an example somebody getting on here and they're really, they're falling in, they're much closer, we have a measurement here, and it's in a letter, so it's not a natural foot size, it's a specific measurement to these insoles that will correlate, and you put the insole down, and now we can measure and see how easy it is to balance that ankle. So without me having to do any work, I'm going to naturally be in a more of a fallout position. If my foot was falling in, it would help to counterbalance that. All right, so you see if it's worth actually getting an insole. You can also, and we have patients all the time, bring in their insoles that they currently have and see if they're actually doing what they're intending to do. And a lot of times they're not, or they're overused, and there's a new need for them. All right, so you can get a sense here. And then on the squat, how easy is it to keep the knee where it needs to be in relation to the laser? All right, so if somebody is without the insole, falling in quite a bit, and you put the insole in and they're in a much better position, then these may be appropriate, especially for those type of movements, and depending on how aggressive people are getting with their exercise. Walking around they may be totally fine, or even doing some body weight movements they might be totally fine, but you might want to start thinking about wearing the insoles for some heavier lifts, because where it's really, really important to have that good knee and ankle position under heavier loads. All right, so that's kind of how you use this device for many things. We use it quite a bit. We found a lot of benefit, and we've also had patients say a lot of good things about the insoles compared to other ones. So we've had a lot of success with it. See you next time.